Yes, a viable egg, a good egg, the egg that has a good quality, one day, and that is it. And she dies off, and it's gone. I'm using she because it's female, and it goes off. That is the bad thing about it. Now, how do you now target that ovulation? There are different ways to know, okay, yes, I've ovulated. Some people use basal body temperature. Let me talk about how we chart the body, basal body temperature. Basal body temperature simply means I'm checking my temperature first thing in the morning, immediately I wake up, while I've rested. When they say basal, that is after you have rested, everything is calm. You check the temperature. So in the morning, the first thing you do when you wake up in the morning, you check your temperature, you know what value it is. You start checking each day, every day like that. You keep checking. Maybe you start from the 50th day of your cycle, of your menstrual cycle. You start calculating, you start charting, you chart it, you chart it, you chart it, you chart, you chart, you chart. And the day it rises at the peak of that chart, you know that okay, yes, that day is probably the day I'm going to ovulate. Now, why it's not reliable is because one, sometimes we have fever, we have a flu, we don't sleep properly, probably we have insomnia, or maybe in the middle of the night you have intercourse and all those kind of things. Do you understand? So sometimes your body basal body temperature is not really certain. Now, another sign of ovulation for some people, sometimes you have what we call some form of cramps. It mimics menstrual, the way you have when you have menstrual cramps. You have it at a particular side of your thigh, or like that, just at that angle of your thigh. You feel it there. Sometimes you feel the pain there. You feel it there. You know that okay, yes, ovulation is about to occur, or it has occurred. So some people have it. Some people are lucky. They see that sign. You know that yes, this is ovulation coming. So they target it and they achieve what they want to do. Now, for some other people, they might have what we call ovulatory cervical discharge. This cervical discharge, I know everybody here eats eggs. You might have fried egg, boiled egg, whichever one, but you have seen raw egg, the way it looks like. You know the white part of raw egg. Some people have that kind of vaginal discharge. Immediately you see that vaginal discharge, that it's not smelly, it's sticky like that, like egg. When you put it between your fingers, it's like that. You know, it's slimy and everything. You know that okay, yes, that's ovulation. That is, people are lucky they have it. Now, do you know that all these things I've mentioned, I never had any of them? No ovulation pain, no ovulatory pain, no vaginal, no sticky vaginal discharge. I did not egg white vaginal discharge. I did not have it. I didn't have ovulatory pain. My basal body temperature, I was keeping it. Can you remember? I was keeping it, and I never had that spike that okay, I had temperature of 37 today. Then the next day I had 37.5 or 36. I was always having normal 36.2, 36.3, 36.5. I never went to that 37 that is in the textbooks. I never had that. So you can imagine how frustrating that can be. You are doing everything. You can imagine how frustrating it can be. I never had any of those signs. So you can see where we are going to. So for me, there's no targeting of ovulation. In fact, ovulation prediction kits did not pick ovulation, has never picked it for me. Even when I try mornings and nights, because there's a particular time you use the ovulation prediction kit. Use it from 11 a.m. to about 3 p.m. or 4 p.m. That is the best time to use it. To be able to pick that, pick the hormone, the ovulatory hormone, progesterone, to be able to pick it up. But I did not. I did not have that. So I'm sure some people too are in this kind of position too. They have never had something like that before. So what will they do? What can they do? We are moving on to the next stage. So you have determined ovulation, and you have never picked it. So what will you do now? The next phase is for you. And remember, we're talking about infertility. You have tried for 1 year for those below 35 years of age for female, and for 6 months for those above 35 years of age. I'm trying to say that again so that people will understand. So you've done all that, and you can't even determine ovulation. So the next phase of what we are going to do now is to go on to check out what is happening to my body. Am I actually ovulating? You know, you can't be ovulating and not have all those signs. You can't be ovulating and never have all those signs. So what will you do now? The next thing for stage for you to move on is to check, okay, I might be ovulating, but I'm not getting pregnant. Are my tubes patent? That's the next phase you go to. Now, how do I want to know if my tubes are patent? I don't have spiritual eyes. I don't have a spiritual scanner or anything to check. So now the next thing for you to do is to find out your tubes. So that is where you now run to the doctor. The doctor is going to perform. First, he's going to have ultrasound scan done. They'll check your ovaries. They'll check, do this person still have ovarian reserve? They'll check that part. They'll check like that. After checking the ovulation, that whatever they are doing in the scan is just outer. They're not checking you outside. Not that they are going anywhere deep. Then they want to check your tubes. After checking your tube, how do they check your tubes? They have what we call HSG. I don't want to mention the full name. HSG what they will do that they will infuse like a dye to be able to check, okay, are the tubes patent? I went through that though. I'm telling you my story. So you put the dye is going to pass through. Then if there's a spillage, that's when they mean spillage is, for example, let's assume you have a balloon, and you want to check if that balloon is leaking. You put water in it. If it doesn't leak, it means that balloon is good. But for HSG, for the uterus, when you are checking the womb, let me use the word womb. Can I use the word womb? When you are checking the womb and you want to check the tubes, if they put water inside, let me use water because we call it dye. If they put the dye and it still stays there and there's no leakage, knows that the tubes are not patent. But if they put the dye and they see that, okay, just like a balloon that already has holes in it, if you put water in it and it spills, you see traces of water coming out of the balloon, that simply means that tube is patent. So we are good to go. So we've passed that hurdle that, okay, yes, the tubes are patent. Then now I want to determine the ovaries. Are they working? How do we know if they are working? Then they'll send you to have hormonal profile done. The doctor will interpret it. He'll tell you to come on the second day of the menstrual period, and they'll take the samples, they'll check if you still have ovarian reserve and the likes. We've dealt with that. Now, there's another thing that the doctors will also check in your womb. Do you have fibroids? Where are the location? I think doctor has a video on fibroids which he discussed extensively, so you can go to his page and check it out. Now, the location of the fibroid is very, very important. That's the first thing. Number two, if they are multiple and if they are distorting the womb, are they multiple? Are they distorting the womb? Those two things are important. There's what we call the endometrial growth plate. If you go for a scan and they tell you that, oh, they saw multiple fibroid and the endometrial plate is displaced, know that it is somehow impossible for you to get pregnant. It will be somehow impossible for you to get pregnant. Why? Why is it impossible? The endometrial growth plate is an important place for attachment of any baby that is formed. So if there's distortion of that, pregnancy cannot hold. Immediately you notice that they've told you have multiple fibroid. Now, one thing I want to say, and that's why I said it at the beginning, the location of the fibroid really matters. It really, really matters for you to achieve pregnancy. If, as I said, you can check doctor's page, you can check my husband's page, you see he discussed it. If the fibroid is located at the cervical region, when we say cervical, I'm not so good at drawing. My husband is an artist.
Let the real artist hear you.
So this is our V. I'm going to do what this is our V. This is our cervix. These are our tubes with eggs attached here, eggs attached here. These are our tubes. So this is our womb, or what we call uterus in medical terms. So this is our cervix. So after intercourse, this is your V. After intercourse,
Write it out now. Write it out.
I don't know if they would.
It's okay.
After intercourse, you expect the sperm cells to swim up and come to this place and bind with whatever egg is released, like that. Then fertilization will take place in the fallopian tube. So this is where fertilization, this is where the sperm will meet the egg and they will form the baby, or the fetus, what we call the fetus, to form the fetus. So now imagine this is where the sperm is supposed to swim up. If you now have a fibroid at this place, you know that this fibroid is already obstructing the cervix. Can you see from there? It's already obstructing the cervix. So how will the sperm swim up? So automatically is a no. Pregnancy cannot happen. But if and second now, I've told you the migration of the sperm. The sperm is going like that. If the fibroid is here and the egg that is released is from this ovary, fibroid is here, automatically nothing can happen. So now, after your HSG, the scan, the test I explained to you that you use a dial to check if the tubes are patent, like that, if the tubes are patent. So if the HSG test comes out and shows that the whole of this side of this tube, nothing is happening, is blocked, and it's only this side that is patent, automatically the function of this ovary here will not stop. It will continue. The function of this one too will continue. Now, there's one funny thing about ovulation. Ovulation alternates. Ovulation alternates. It can start in January, the egg can be released from this ovary. In February, it can be released from this ovary. In March, it can come here. In June, like that. They alternate. Sometimes this one can do it February and March, and this one will do June and July, like that. So if, for example, you have for 2 months is this particular ovary that is ovulating and this one is resting, and the sperm comes up and this place is blocked, it can't come to this released egg. If the egg is released from this side, it can't come here because what? There's already one fibroid that is obstructing this side. Do you understand? But by whatever means, if this particular ovary is the one that releases egg and the sperm can swim up to it, beautiful. Then another thing, one last thing. After you have achieved fertilization here, the sperm has come, the eggs have all meshed together, they form the baby, and they want to start coming down. After it forms in the tubes, it will have to come now to the womb. Remember, we said this is the womb. It must come and bury itself here. It must bury itself here. So as it's coming down, it now went and it meets a fibroid as big as this, meets another one here, meets another one here. Where on in heaven's sake will this ovary baby attach? Can we see? I don't know if we understand what I'm saying. So there is no place this baby will attach. At the end of the day, the patient will come and tell you that my pregnancy test was positive. It was positive, I'm sure. And the doctor is telling you that but you are bleeding. You say, yes, I know I'm bleeding. And they check and they say, oh, she has multiple fibroids. Automatically, you've lost a baby for that month. And luckily or unluckily, this particular ovary might not bring out another egg. It will go back to this side. And remember that we said there are fibroids here everywhere. So at the end of the day, you are not able to achieve any pregnancy for maybe some months and the likes like that. So I don't know if we are following. I'm not like doctor. I'm not a very good teacher. I'm not like doctor. Doctor is a very good teacher. I'm learning from him. So I don't know if we understand that aspect. So ovulation alternates on ovaries. If you have two, it alternates and the likes. Now, after you've sorted out the cervical region and ensure that you don't have fibroids, you don't have anything. So what is the next thing? I'm ovulating. The doctor have told you by the time they did the hormonal profile, your hormones are fine, you're ovulating, you are doing everything. Now they'll move on to the male. They'll check his sperm. Their own is just one thing. They don't have problem, just one. They'll just check the sperm. If it is normal, then you'll be wondering that, how do I now, what is actually happening? There's something that many people do not understand. There are some things they call antibody rejection. Yes, it is real. Some people say it's textbook stuff, but it is real. Antibody rejection. Antibody rejection is just like the man is bringing his sperm into you and your body is rejecting the sperm. I'm not talking about what people say they had sex now, they had intercourse now, and they stood up and everything poured out. No, that's not what I'm talking about. I'm talking about antibody rejection. The woman's body is rejecting the sperm. The man doesn't have any problem, but her body is rejecting the sperm. For some people like that, what they do sometimes is just to give her some drugs to suppress her, sort of suppress her immunity so that her body doesn't reject the sperm. That is one aspect. I even have a case study, very classical, it happened. That's one aspect. Then, after you've done everything, they've done all the tests and nothing is doing, they can now proceed to do probably IUI. What IUI simply means is that they will try to introduce the sperm directly into the what? They'll deposit the sperm directly into the uterus. Directly. They won't wait for it to pass through the cervix and all that. They'll deposit it directly into the uterus and expect it to travel to meet the eggs, whatever eggs that is ovulating for that month. They'll monitor it, they'll track it and everything like that. So if that does not work, then they can now proceed to do IVF. Now, glory be to God, I didn't have IVF. I don't know how it happened, but it happened. I don't know how it happened, but it finally happened. So what I'm saying is that infertility is real and it happens. So people should not stigmatize others. People should not start saying, I understand how it feels. If you have not been there, you cannot understand how other people feel about it. So I don't know if you have questions before I proceed to a next phase. Their phase is very, very interesting, which I'm going to talk about.